Hello there, and thank you for joining us here on UPfront. I am Blessed Sunga. Will the Health Minister, Kwabena Minta Akando, apologize to doctors at the Tamale Teaching Hospital? Or how does he intend to resolve the strike which these doctors are embarking on over a clash, or if you may want to call it confrontations, that transpired at that very hospital over negligence and what the ministry describes as the failure of the CEO for that hospital, Dr. Atik, who's now been dismissed for his failure to manage the hospital well, a reason for which negligence led to the death of a 31-year-old up north. Is the reason for which there's so much tension up north, with the doctors declaring a strike and failing to heed to calls by the health minister to resume work. So why is all of this happening? And for many of you who have not seen that scene, we'll be putting it right on the screens for you to have a feel of what happened a couple of days ago. But why did that happen? And was the minister even right in the first place to confront these workers in such a manner? Will he apologize? And if not, what would be the implication for the management of the hospital up north? It's the highest health referral facility in the northern parts of the country, a reason for which many are wondering, and of course stakeholders are getting concerned about what's happening there. So let's tell you about the guest helping us to do the conversation for today. Dr. Nsiah is the former presidential advisor on health. He's joining us via Zoom. Dr. Thomas Anaba is Garo MP and also a member of the Health Committee in Parliament. And then we'll be speaking to a number of some more stakeholders who will be joining the conversation shortly. But since it's a developing story, let me first of all welcome Dr. Nsiah, who's joining us via Zoom now. Thank you so much, sir, for your time here on UPfront. We'll delve into all of the issues, but I want us first of all to take this break, and when we return, we'll get you all the details. And thanks for staying with us here on UPfront. Joining me now is Garo MP and Member of Parliament's Health Committee, Dr. Thomas Anaba. Also joining us live on Zoom is Dr. Anthony Nsiah, former presidential advisor on health, and we'll be speaking to the National Coalition for NGOs in health, who will be, of course, sharing their thoughts on this matter, because the national president will be joining us shortly. Thank you, gentlemen, for your time here on UPfront. Dr. Nsiah, I'd like to start off with you first, because you know about Dr. Atik, who's been managing this highest referral facility, if you may want to call it, up north. But now his career, or if I may put it lightly, his job as the Chief Executive Officer of the Tamale Teaching Hospital is now on the line. In fact, he's been asked by the Health Minister. Are you surprised, first of all, about this decision by the Sector Minister? And what was your reaction when you saw the video in the first place?
Yeah, thank you very much. Can you hear me?
Loud and clear, sir.
Yeah, what I know is that, I mean, if you want to dispose of the services of a chief executive, there are ways of going about it. You can call him, write to him, or ask him to leave, because apparently it's a state institution. So the state, whoever is leading the state, if he doesn't want that chief executive to work, can ask him to go. But the problem is that is the person doing that following the laid down regulations. That is the most important thing. That one, I believe and I know that if the person is aggrieved, he can seek legal action. That is about the chief executive's dismissal. If you want to do it, go about it in a way that it will not cause any problem as it has caused today. Now, the people who are suffering are the poor patients. They are the people in the catchment area of the Tamale Teaching Hospital. So I believe that that is the way to go.
How do you tempt the conduct of the minister? Well, usually if you have every minister take up their post, they would want to ascertain what's happening on the ground, visit some of the health facilities. And I believe it's in that spirit that we're seeing Kwabena Minta Akando visit a number of referral facilities. But it's turned out the way it's turning out, possibly because of what some say as perhaps provocation on the part of the CEO or former CEO. Is that what your assessment of the case has been?
My assessment is that what happened on Monday, in my opinion, was not necessary. It was uncalled for, because if I see the video and I see it very well, I'm not sure where the altercation started, where the press and the minister plus the MP were. If they were inside the emergency ward, it's very unfortunate, because I'm sure patients were there. If you want to have any discussion after a visit by an honorable minister or by any high-ranking person, if you finish your rounds, the most important place to have discussion is in the office of the CEO or in the conference room. You can go and sit down there and discuss. And then you can talk about anything. If the altercation have happened over there, maybe it will have been have a less impact than what is happening now. Because patients are lying down there. If I'm a patient, the next thing I will do is I pack my things and leave the hospital, because I will be afraid. If I'm also a staff, I'll feel very aggrieved, especially if I'm a medical staff. And there are ways of doing these things, and I believe that it didn't go well. I saw that the minister has a chance today. He has a press conference. If I were the minister, I would just say that I would say I'm very sorry to the staff of Tamale Teaching Hospital for whatever happened. That would have been my first statement that I would have made. And so be it. That's what has happened.
Yeah, if that's the position, you support, are you then not emboldening these health workers? And mind you, there's a public perception about them, about their service delivery, very poor in many public facilities. Is that not the case?
No, we are not emboldening anybody. You see, that's what I said. A minister is there to serve, the same way that the health workers are also serving the community. You have to listen to them. Maybe they have peculiar problems that they want to inform you so that you can solve it for them, or together you solve it. But if you go about it in such a way, it doesn't augur well for anybody. And that's the reason why maybe what is happening is happening. Have you seen the conditions that they've given before they go back to work? 21, I counted them. You don't allow that thing to happen. We mitigate all these things. We have to prevent it, as in our parlance. Prevention is better than cure. And you could have done it in a very nice way without causing all this hula balloon. That is my opinion.
I see. Interesting point you have there. Unfortunately for yourself and Dr. Thomas Anaba, you've all worked at the Tamale Teaching Hospital before. So that gives us a sense of, very top people who understand, this very facility that we're talking about and the status at which it is. Let me hear from Dr. Thomas Anaba first, and then I'll come to you, Dr. Nsi Ansari, about this facility that we're talking about and who should be taking utmost responsibility for what we're seeing today. Dr. Anaba, if you were to lay the blame squarely at someone's doorstep, would that be the minister or the former CEO?
Oh, thank you very much for having me, and good evening to my senior, Dr. Nsi Ansari, for speaking before me as well. It's a long time.
Good evening, Thomas. How are you?
I think, yes, sir, I'm doing fine, sir. Right. Listen, I think that what has happened is something that shouldn't have happened. What we need now is to see how we can get the doctors, the nurses, the hospital staff come back to work and serve the good people of Tamale Metropolis, because their services is very dear. We know they have challenges, and I think the minister perhaps went there to see what he could do to solve the issues. But during the conversation, a dispute occurred, a discourse occurred, and this has led to a lot of public backlash or whatever. I am not here to say I'm blaming this person or that. I am here to say that, look, this thing should not give the doctors the opportunity to lay down their tools. They have challenges of tools to work already, and patients were already suffering. Now they have laid down their tools. It means that patients are going to incur the wrath. The minister is not going to suffer for it. The doctor is not going to suffer for it. We know each and every one of them have their reputation. The doctor has his reputation. The minister has his reputation. All the same, I think that if you are talking to elders, if you are talking to elders and the elder perhaps errs, I think Dr. Siasari would be witness of this, you keep quiet. That is what I would say. And if it didn't happen and it brought about challenges.
Yeah. I'm just not too sure who the elder...
And the minister had to...
Yeah, I'm just not too sure about who the elder will be in this case. But that's why I'm asking about, you know, the status of the facility. Because mind you, that's what prompted all of this. With the health minister himself not being happy about some of the developments in that facility. But you know much more about the problems because you've worked there before. Are these challenges prevalent? Would you say they are entirely the fault of the CEO? I guess that's what I want to establish.
I think even the request the doctors have made, the lack of equipment and supply that they have made, consumables they have made, indict the CEO.
Really? Well,
it indicts the CEO. Simple doctor can buy without going even to the region.
Why the CEO?
Without going anywhere. Come again?
Why the CEO?
No, the CEO is the administrator of the hospital. They put him there to solve problems.
Okay, and I get the point you're making there, Dr. Thomas Anaba, but we'll get to you shortly. It appears your network is not favorable, but with very controversial points there, Dr. Nsiasari, about who should be taking, you know, responsibility, and he feels that this should be the chief executive officer of, now former, at least there's an incoming one, of the Tamale Teaching Hospital. You also know this facility very well. Do you side with him on this?
Quick, to put the responsibility on anybody now. The reason being that I've worked in Tamale before. I was there 30 years ago. I worked there for 5.5 years. And the water problem is not a problem which started today. But as a medical director then, it was a regional hospital, that was what occupied a lot of my time. At times moving to the Water and Sewage Corporation to make sure that at least we get the tank filled so that the water will flow. Because in a hospital, if you don't have any water, you forget about it. I mean, why should patients come to hospital when there's no water? But there's a perennial water shortage problem in Tamale municipality or metropolis. And that is a fact. I'm not too sure about the electricity problem because we also used to have a standby generator. And we're very also in contact of NETCO, that light was also coming there every time. Yes, I agree that the management, not only the CEO is the head of the management team, the whole management will have to sit up and make sure that things work well, especially if it is consumables, which you buy and also replace. And I'm very sure that if health insurance also is paying, which I know that they've been doing, then the management should sit up and find out where their money is going and do proper budgeting. That one, I'll say yes. The CEO is the head, and he has to make sure that the management is up to scratch.
Okay, so partly you agree that there's a problem there, and of course you've left office not too long ago. It's just been a couple of months, so you have first-hand assessment of how these teaching hospitals, not just in Tamale, are faring, but across the country. If we take a look at what's happening to our referral facilities, the teaching hospitals, and looking at the picture across the country, would you say that not much has been done in terms of investment in these facilities, or you feel that it's much more about the management and the maintenance culture in these organizations?
I've said there are two things. Both, we have to do a lot of things in our teaching hospitals and also maintenance culture. For example, our 5 or so teaching hospitals were built a long time ago. For example, Kolebu was built about 100 years ago, isn't it? Kolebu needs to be retooled and even rehabilitated. Some of the buildings will have to go and replace. 2, Konfanoch is about 75 years old. Tamale was built in 1972. And I think Cape Coast is the only new hospital. Cape Coast and Ho are the new ones which have come on board. But the whole issue in Ghana is maintenance. And I'm saying this because I have managed hospitals from the district regional teaching hospital before I became the Director General of Ghana Health Service for about 2.5 years. So I know what I'm talking about. Maintenance culture is very, very important. And that's where I put some of the blame to the management. Management should be up and coming, do proper budgeting, and make sure that they put about 10% of whatever revenue they get into, also making sure that the things that they have work. Because once the things are working, the machines are working, you have reagents, you have also the other medical equipment all working. That is what brings you money. You put in money and it gives you some small money for you to run the hospitals. 2, if I have my own way, I believe that it's time now that at least the teaching hospitals have to be given to a management team to manage. Management team, which I mean in a PPP way. Why can't you give the teaching hospitals to management consultants to run like they are doing at a bank hospital? So that you take them, put them responsible to everything, run, collect the money, and then let's see how it will go. You employ your own people and let them work and give them the conditions of service that they are supposed to work. It can be done. And it's time that we should start thinking about that. Once you do that, most of these things will be better managed than what we are doing now. Because most of the equipment are bought by government, and the people who are using the equipment and working on the government are also paid by government. The buildings are government buildings. Electricity is paid by government. So why can't you run your CT scan? But it means that the tariffs for these things should be comparable to what happens in the private sector, which can be done so that anybody who is going to these teaching hospitals are properly referred. That to me is a solution. Maybe one day I have to come and sit at Joy FM and then explain all these things properly.
Indeed. You have that wealth of experience in the sector, so we'll be willing to have that conversation.
I'll come and then explain.
Indeed. But we have a crisis. We have a crisis now. The manner in which... okay, if you could just land on that point. Yes.
I believe the way we can solve the crisis is we have to talk nicely to people. We have to coerce them to come back to us. You see, no doctor. I'm a doctor. I'm a consultant surgeon. Once you are even on strike, now I'm sure they are seeing inpatients. You cannot leave them. It's against our Hippocratic oath. It's only outpatients and emergencies that they are not seeing. If you don't see emergencies, where will the emergencies go in the northern area? Because that is the only place that they have a proper accident emergency center with trained accident emergency doctors and nurses. So it's the people who suffer. I think that as quickly as possible, I'm appealing to my colleagues that they should look at the things that they've put down. They cannot, the government and the minister cannot provide all the 21 conditions that they put out. I'm sure some of them are mid-term and all these things, but they should look at the patients, and I'm pleading with them so that they can then go back to work.
But the easiest one should be the apology. Should that come?
Yes, the apology should come. It should have come this morning. I don't know when. There's nothing to say, I'm sorry. Nothing. It doesn't take anything from anybody. It doesn't take anything from anybody that, what went on, we went overboard. As Dr. Thomas Adaba said, I'm very happy that he said that. It shouldn't have been that way. If you want to even say anything to the people, to the doctors and to this thing, call the senior staff plus the management into the conference room or to the CEO's office and tell them what is happening here. I'm not happy about it. What are your problems? When I go back, I'll try and see what you can do. Would that press follow you?
I see.
Because patients are there.
Right. There's another perspective I would want to take from you, but the NGOs in health as well are concerned about what's happening. I'll come back to you, Dr. Nsiasare, and then Dr. Thomas Anaba. But for you, Brighton Nyako, who's the national chairperson of the Ghana Coalition of NGOs in Health, what really has been your observation in all of this? Because now there's a strike, there's a crisis at hand. How do we resolve this? What's your recommendation?
Thank you very much.
Hello, Bright.
Dr. Thomas.
Yes.
Yes. Can you hear me?
Loud and clear, sir.
Yes. I think my very senior colleagues and then the experts they have said all. They've spoken like CSOs who do. you would agree with me that they all ended at the community will suffer when we continue to work the way things have happened now. So it's about dialogue now. The situation that is happening now is very dicey and very sensitive. We cannot take sides that this did the wrong thing and that, except that the scenario, the scene that was created in Tamale concerning the minister's visit has not been very, very encouraging, because it's been made too public what is obvious and happening in the facility. I agree that they could have called an internal meeting and then hold a discussion. It would have had a better discussion with the CEO and the team, the management team, and then he would even understood them the better what the situation, the prevailing situations are. Except that the minister probably might have been so worried and daring because there was an incident of death. It couldn't have been either the fault of here or there. That is why there was the need for the dialogue. But otherwise, what has happened in the presence of the minister himself, and then what the responses that came from him has not been very encouraging. And I think it is worth mentioning an apology to the doctors and then to the other management, so that they look at how they could resolve it internally and come out to save Mother Ghana and the community at large.
Do you feel that the chapter should be entirely closed on the reinstatement of the CEO who's now been dismissed?
It was actually a hard decision. They should have given the CEO the opportunity to respond to some of the queries that were raised by the minister, and also allow him to even resign or something without making it public. And then he could have a further investigation to look at what the situation has been and then what they could do about it moving forward. But it came as a shock to the whole public and then the medical staff. And then you agree with me that it was distasteful to take such a situation harshly from the minister. It is something they could have spoken about it in a more let me say polite way than how it was presented, and there would have been calmness.
Do you feel that that opportunity is entirely gone? Would you want government to revisit the conversation, perhaps? Now the doctors are listing over 20 items. If the issue of the reinstatement is settled, don't you feel that would end all of this? Perhaps give some level of confidence to the doctors to return?
Yes, it would have been the best to reinstate the CEO. But what would become of a new minister who has just assumed office and wants things to be done the right way in quotes? So you could not you could not easily say the minister might also withdraw his statement and then just say everything that was every action he took is too harsh and wrong in that sense. But I believe they could still do a dialogue and then calm tempers and look at how they could. The CEO could be given another opportunity if the minister feels too difficult on himself to reinstate him, and probably get this thing resolved, and then the community and the patients could have their peace and then enjoy some good care.
Yeah, interestingly, we have a number of your members, the NGOs working up north, and how dire the health sector is there within the Tamale enclave and also the north in general. Given what's happening now, are you able to paint a picture as to what the effect might be if this impasse is not resolved in the next coming days?
Yes. CEOs, CSOs, as usual, we would not be happy to see our doctors be on strike for whatever reason. Even when they are crying for their own job ethics and finances, we still appeal to them to withdraw strikes and then take care of the patients. It is no different from this one. We will still appeal to them, whichever the case is, to handle this with the necessary diplomacy that it deserves, and then go back to work and take care of the suffering patients. We have no idea about how this thing happened, but at the end of the day, we are the people who are going to lose our lives, our precious children and wives and the family. And that is what we commit to telling them, that they should look at it and then withdraw their strike and give the patients the needed care that they deserve.
Okay, right, just stay a bit more with that. Dr. Thomas Anaba, your committee in Parliament, the Health Committee, has been on a tour. I don't know if you've been to the north yet, but before we address, some of the findings you're getting on this tour, just tackle this for me. The speed with which the former CEO was dismissed and for a new one to pave way. There are many who speculate that this might be a politically motivated exercise, knowing that, just hours after his dismissal, there's a new CEO.
Thank you very much. Yes, I agree with what my colleagues on the other side have said. I think that the situation in which the CEO was dismissed is not something that has happened before. The encounter that took place, the loss of life at the hospital that brought the minister there when he was going to visit and realized that somebody has lost his life because equipments were not available and the rest. That might have been what has pushed the minister because of the passion in which he has for the health delivery system. I think everybody knows Honorable Akando, the way he's very passionate about health. Even when he was a ranking member, how he took time to go around to hospitals, go around to places to fight for the health delivery system, to be well equipped and the rest. Unfortunately, he goes here and meets a serious challenge. And in that, sometimes emotions can play a role. And then this brought about this confusion between he and then perhaps this was just to ensure that proper management is put in place, because all what they were requesting for was something that I think that if management of the hospital was set up right, they wouldn't have been demanding for most of the things except in future. So what I'm trying to say is that a new CEO coming in, they have appointed a new one. They have removed the formal, the one they have kicked out. And definitely there's a need to have a head to run. The active person will be there, whether he will remain as a permanent acting CEO, or a permanent CEO, or he will stay and then go through interviews and then the rest, and a new person appointed. That one we can't tell. What we need now is to get a manager quickly to try to handle the hospital, group the people back. And I will stand here to appeal to doctors in Tamale who are on strike at the Tamale Teaching Hospital to temper justice with mercy. I, for one, I don't believe in strikes.
Okay, yeah, but this is the issue. I'm saying that. Don't you feel this is all politically motivated? That's the concern out there, because the speed with which we are seeing the new appointments just hours after you fire the individual without, necessarily triggering any query processes.
Is there anything prohibiting a CEO being fired and a new one appointed immediately? There's nothing prohibiting it. There's nothing prohibiting it. So I don't see why speed should come with politics. I sit in here, though I was removed from office similarly for doing no wrong. I think my senior brother and my senior colleague is there for doing no wrong. I went to court, like he said. If he thinks that he was removed wrongly, he can go to court and then discuss it. But what I need to be done now is that I'm begging the doctors in Tamale to temper justice with mercy. We should find a way of resolving their impasse with the minister, but we shouldn't let it affect the staff. I know they are very hard-working doctors in Tamale Teaching Hospital. I know they are very hard-working doctors. They have lack of resources, but they are doing their best to run the hospital. We shouldn't let our absence again put more burden onto the patients. If management is failing and because of that they failed, we'll try to see how we can work with the management to improve their resource mobilization to ensure that they get what they need to prevent the occurrence of unnecessary deaths.
Yeah, but it's
for sure,
interesting.
I'll tell you that the doctors at the emergency are doing a very marvelous job, and I think they need to be saluted for that purpose.
Yeah, but it's interesting you're raising this point, because you were in this situation before, as you were, talking about in retrospect, but you were not happy at the time when it was done to you. So why are you perhaps encouraging your own government to go after same?
No, I'm not encouraging my government to do same. But as I've told you, when he went to reach, did he fire somebody? When the minister went to reach, did he fire somebody? He didn't. He went to another hospital and there was an issue of a death. And he was trying to know what caused the death. At least just give him some information or say, okay, let's move to an office and discuss it. You could have told the minister straight away that way. But he was carried by, I think, by the emotions of the death of the patient and perhaps acted that way. Let's understand it. I don't also blame the doctors for trying to explain that they lack equipment and they continuously insist that they lack equipment. No. So both of them, it's a miscommunication from both. They could have analyzed this thing very well if they had all drawn back to a boardroom, like my senior colleague said. One thing we have to note that from the beginning, if you watch them moving, they were walking so nicely, chatting with each other until the conversation came in. That was when the whole thing went bizarre. I'm saying that it's miscommunication.
Do you feel that we're beyond reversing the decision? At least it's not. I mean, it's not too difficult, is it, for the president to do? Just pause the new appointment, give him some leeway, hear him out, and perhaps some other punitive measures and reinstate him. How about that?
That is a prerogative of the president and the minister. If they want to do it, they would understand it better. My request now and plea to my colleague doctors in Tamale Teaching Hospital is to think about the patients and then go back to work. Okay. Whilst we see how we can resolve the issue with the minister.
And I believe that by now you're receiving calls, perhaps, from some good friends up north, perhaps constituents. I'm not too sure about the demographics, but people who are complaining to you about the impact already, which is there.
Yes, because they are complaining, and I know of it. Tamale Teaching Hospital is the biggest referral hospital in northern Ghana. Virtually patients even from my village in Garu comes there, from Pusiga, from Nabrango, from every. They come there. Them laying down consistently pleading. They are serving the entire northern sector. So they should take this issue with the minister to the boardroom, whilst we see how we can get resources for them to continue providing the very important and vital services that they were providing. This mishap would not happen again. And I think with what they have done already, they are going to start benefiting from it, because definitely the minister would like to fulfill their promises that can be fulfilled immediately, while the rest are fulfilled gradually. So my own is a plea.
Right. And you've been to some other facilities, because your committee in Parliament has been touring some of these facilities. I'll come to you, Dr. Anthony Nsiasare, shortly, but let's hear the member of the Committee on Health in Parliament, because Dr. Thomas Anaba, you have been together with your team. Even as we speak, we understand you are in the eastern region. So tell us about what you are also uncovering there, because the minister might go to some of these regions. Is it a good picture?
Thank you very much. Yes, we went to Kumasi South Hospital, which is the regional hospital for Ashanti region. We went to Komfo Anokye. Then we came to Koforidua today. In fact, we were impressed. We were impressed that at least Kumasi South Hospital, the way they've handled the hospital, very neat. They bought equipment with their own IGFs, which is surprising. They've even tarred the frontage of the hospital from their own IGF. And they are making a lot of profit from the hospital to run several activities alongside. The only thing they need is human resource and space to expand the facility. We went to Komfo Anokye, we saw similar things. They've been able to develop and renovate more old wards into new ones with the help of His Majesty Otumfuo Setutu II. The hospital is looking very neat. The emergency, which is crowded, but very neat. And they have equipment that they are refurbishing themselves. And then the rest. We saw a vast difference from what we are hearing from Tamale. We got to Koforidua and it is marvelous. They've been able to keep the hospital impeccable, doing research with their own money, publishing, bought 8 dialysis machines on their own. They didn't rely on government, from their own internally generated funds, setting up a very beautiful ICU for themselves with their own internally generated funds. The emergency is full of monitors. I counted 11 monitors at the emergency at Koforidua, which shows that the management there knows what they are doing. And that is what we want to see replicated in other places. It shouldn't just be that government. How can others do it? That others are sitting down waiting for government to come and do everything. When you have the resources yourself, it's how you plan. The more you plan and do good things, patients will come and the revenue will increase and you take care of them better. So I think the observation we have made so far has been very, very delighting. And I think that we give thumbs up to the 3 hospitals we have visited so far. My group, we have visited 3 hospitals so far. Yeah. We are currently just arriving in Ho to visit the whole regional hospital tomorrow.
That will be a major one then. But of course, critical question you're raising there, and I put that to you, Dr. Anthony Siasare, the point about how some are getting it right and the others are simply failing at it, including, if I may just put it lightly, the Tamale Teaching Hospital, which the minister is concerned about.
Yeah, thank you very much. And I think my good friend, Dr. Anaba, has said a lot of things. You see, first, what I would say is that when you face these issues, you don't use emotions to take decisions. So if that was what happened, I think it's not the right way to go. I hope it doesn't happen.
Oh, okay.
So I'll go to the hospital management. As I told you earlier, I've managed hospitals before. I have the privilege to manage hospitals from the lowest level to the highest level and generally to the whole country. I know what I did, even in Tamale. I think Dr. Anaba knows when I went there, what the situation was like. The kitchen was not even working. Big kitchen. I made it start working when I went there. And it's a way that you plan and budget. And ideally, you see, it's not only the chief executive who should be blamed. The supporting directors, very important, who are what? Director of budget, director of finance, the procurement director, very, very important. The supply chain person is also very important. The pharmacists and everybody. Because it's more you put in. That's why I'm sure Kofodia. And then you should go to also, if you are in Kumasi, you should have gone to Bekwai Hospital and find out what they are doing. One of the best run hospitals.
Yeah, I see. That's an interesting one there.
Yeah, it's a very interesting hospital. You see, there were a lot of the young guys who were coming back to me, and then some of us were this. I think there should be, and I believe that before maybe I can't work anymore, we have to come together and train people before they are appointed as managers, as the chief executive. People are saying that, why do you put doctors and all these things? I believe that somebody who understands the system better can run the hospital better. In US, in UK, they have both non-medical chief executive and medical chief executive. I know there's a research which went to always say that those who have idea about hospital, about medicine were doing very well.
Manage better.
Yeah, they compare all those things. Because Dr. Anaba and myself knows that when I'm going to buy, for example, a catheter, I know the different types of catheters. Even I would say sutures. I know the different types of sutures. Some are cutting, some are round body, some are 2-0, some are 3-0, and all sorts of things. So we should train them, not just appoint somebody, say go and work. No, it don't work. Even if you have appointed a new acting CEO and he's not trained, you find it very difficult. So this is my point. And I believe strongly that we should have a second look at our big hospitals and let them be self-sustaining. It's possible. It can work. And they will follow through a very well referral system. Not everybody gets up and goes to Tamale Teaching Hospital and all sorts of things. And then they can do what they are supposed to be doing. And I'm also appealing to our doctors. You've shown that, yes, you are united and everything. They say that if you touch one, you touch all. The other like the nurses. If you touch one, you touch all. So our appeal to the Honorable Minister is my nephew. He should now know that prevention is better than cure. So when he wants to take all these things, he has to be very, very, very decent about it and make sure that it doesn't cause any problem for anybody. But I believe that we should strengthen the management of our hospitals, should take them through constant training, constant comparison. For example, if you go to Kofodia is working well, why don't you ask the other people who are not working well to go to Kofodia and see what they are doing? When I was appointed the medical director of Tamale Teaching Hospital, I went and spent 2 weeks at home of late Colonel Akwalu. He was the chief executive, he was the medical director there. And he showed me a lot of things with military tactics and all this. He was a military surgeon who went there as a medical director. And we came back. Some of us have training. I also had training in the UK, have training in in Germany, in Italy, and in the US. So when we are talking, we know what we are talking about. So please, doctors, you have shown what you want. 21, you've listed 21 things. They cannot provide all of them to you at the same time, so that we don't have problems in Tamale. I've also had strikes when I was in Tamale before. That time, Tamale Regional Hospital was the only big hospital there. There were no private hospitals, doc. Remember, there was no private hospitals in 95, 96, up to even 2000, until some people went there. When I went there recently, I was surprised that there are so many private hospitals there. So if you are on strike, there was no place. The only place that anybody could go that time was Damango, the Catholic hospital, because they were not on strike. And some of us have to stay on and work throughout the night. So they should know the peculiarities of the place and know what they want to do, so that the people will not suffer. I mean, they've seen what has happened.
Yeah, but
and
Doc, if you're saying all of this, where do we place the persistent complaints about how health professionals in general, and I need to be fair to the doctors, this may not just be a doctor to patient problem, but the entire environment, the nurses and other health professionals, and how they treat patients in these health facilities. It's quite a challenge, right? Because there are so many complaints.
Yeah, the population should know that there are about 3 different ways of making sure that you lay complaint. One, if you are an aggrieved patient or the patient relative, the first place to go is to the management of the hospital. If you are not satisfied, you can then move to Medical and Dental Council and lay a complaint. I've been a member for 5 years of the Medical and Dental Council. There's a penal committee, and if you are not very lucky and they take you to the disciplinary committee, your license can be withdrawn. The same thing with the nurses, the same thing with the pharmacists, the same thing with the allied health professionals. So we have avenues, and if you are not satisfied, then you go to court. Even cases in court, sometimes they bring it to Medical and Dental Council to adjudicate. So patients have the right to ask questions. Patient rights have been written boldly, and I hope that it should be this. I know that some of the hospitals have displayed it all over the hospital. It's only that patients are always afraid to ask questions. You can ask questions when you are being seen. And as I said, there are 4 avenues that you can seek redress. And when any patient loses his or her life in a hospital, there is an internal medical audit. So there should be an audit, especially in the teaching hospital. I'm sure they do it very regularly, maybe at the end of every month or every 2 weeks, why this patient dies, so that you learn from it even as professionals. And then if there's anything which went wrong, the management of the hospital then can query why that thing happened. If it's a systematic failure, then the doctors and the other professionals can then query even the management, that because I didn't have any soap, that's why this patient had infection, post-operative infection, or because the water was not running, the patient could not be cleaned. These are things that then the hospital then put that one in place. Equipment, as I said, we were supposed to, it's a policy, the Ministry of Health, and for that matter in Ghana Health Service, in all the teaching hospitals, that 10% of your revenue should be for planned preventive maintenance. And I've always been saying that if you want patients to have their consumables in the hospital, that brings money. Because the more patients that you see, the more laboratory that you do, the more x-rays that you do, especially mortuary, I say that mortuary is where they get money from. Because the longer, especially down south, they put the patients there, you get money. So why don't you keep your mortuaries very clean and neat, so that people will then bring their bodies there? Why don't you keep your laboratories always with reagents, so that you can always be doing your lab investigations instead of sending them outside? And this is what makes some of the hospitals not have IGF, so that they cannot do what they are supposed to do. I'm happy also now the National Health Insurance is doing proper tariff adjustments, so that they can pay for the utilities. That's one of the areas which were not paid for.
Yeah. Because
cleaning the hospital is very, very important.
I see.
And most of the time, if you think that the cleaning of the hospital is a problem, you give it out, outsource it to people to clean it for you, and they do it with supervision. So these are some of the things that we may have to sit down with the management team If they can involve some of us, we will sit down with them and train them for about a week. And then
on some of these topical issues. But the final leg of our conversation, I want us to focus on the minister himself and expectations. We'll be wrapping up shortly, but let me start off with you, Bright Emisa. You know, the point about expectations for the minister himself, because he's a new minister, less than 4 months in office. That's quite a short period. So he has a lot more to deal with. This is just the start of it, isn't it?
Yes, I agree with you. And like I said, an aggressive minister as he is, and as was earlier mentioned by Dr. Anaba, we know how Mr. Akando works. And then when he was a ranking, how he has always been vocal in the issues that happen at the facilities and then in the medical field. You expect that his expectations are very high, and he may want to see things in its rightful place and to perfection. But he has to take it slowly and understand the system before he could take some decisions drastic such as this in order not to harm the same people he will be working with. For what has happened, it's rather unfortunate, just that I believe for any better thing to happen, somebody needs to be sacrificed. If the CEO is rather unfortunate that he has been the sacrificial lamb here. And I want to assure you that with what has happened, Tamale Hospital will be uplifted again and we'll be seeing a lot of changes there. But still, the minister should work hand in hand with his team, the management, and then the medical staff to understand the situations better before he could take such action.
Yeah, but beyond the hospital, policy-wise, any major expectation?
Oh, yes. I believe Dr. Nsiasare already said a lot. The status of our teaching hospitals and even regional hospitals, there are some basic equipment that we expect them to have. And then the over-reliance of government for these are some of the challenges that we've been seeing in the past. But if Koforidua is able to procure 6 dialysis machines, then why not? All other teaching hospitals could be able to do that. And these are some of the things we expect them to be using their IGF to do in support of the facility and then patients, so we could have quality healthcare delivery in Ghana. So I believe it's a win-win situation when government is able to support the facilities with their needs. Yeah. And then the doctors are also able to take quality or good care of the patients that come in there.
Interesting points there from you, Bright. And Dr. Anaba, for you, are you triggering any moves in Parliament, perhaps to have some more dialogue on this? If not formally, because the House is on recess, at least you're doing that on the backside.
No, we are doing that on the backside. We are going around supervisor work, and then we are also talking behind the scenes to see how we can persuade our hardworking doctors at the Tamale Teaching Hospital to
yeah. Okay. Quite unfortunate that we seem to have a challenge with the connection to Dr. Thomas Anaba. That's obviously not favoring.
See how it can.
Yeah, Dr. Anaba, we just might want to
now and quickly resume work. You'll be able to provide.
Okay.
Appointment.
Okay, a bit of a challenge there. A bit of a challenge there, Dr. Anaba, with your connection. But you're saying that you're doing that on the quiet. Let's try one more time to see if we can hear you loud and clear. We'll reconnect with Dr. Thomas Anaba and perhaps, well, it's just the final leg of the conversation. So let me give the final word to you, Dr. Anthony Nsiasare. Unfortunately, we lost Dr. Thomas Anaba. They've signaled to us that who is the next stop. But the bigger picture about reforms and what to consider as the way forward, what would you say as your final words on this?
Yeah, the way forward is that, I think that there should be more dialogue. And the new minister should remove all emotions from whatever he's doing. He's now dealing with people, he's doing very high professionals. He's in charge. And I believe that if you put emotions aside and always dialogue and negotiate with people, you will have a lot of things being done and done very well. Two, I think the timing of the dismissal, maybe it cannot be changed now, I don't know. You can dismiss anybody if you want at what you want to do, but if you let it follow immediately after going there to have altercation of the staff, then it becomes a problem. Unless maybe it was already planned, which I'm not too sure, that you are going to sack him, but let's find a way of doing things so that when you do it, nobody will talk. But these things, it will backfire. If it was done, he was called, they said that we cannot work with you. I'm saying this because I have gone through that situation before in 2009. I think in Konfanochi, you didn't hear anybody making any noise because I was called. I was said a letter was given to me. I said, okay. Then you go quietly, and then if you have any problem, I went to court actually. Go to court and then seek a redress, and I won. So this is how you do things. So if you want to do it properly and do it according to the laid down regulations, because there's somebody who appoints and there are conditions of appointment and how you can also disappoint the person. So that's what I would say about the appointment and the dismissal of the doctor and the new CEO who is coming. So I wish him well, and I wish my colleague, young doctor who has also been dismissed well, but he has a lot of avenues that he can also seek redress. But I wish that he continues his profession. I think he's a physician specialist also, continue doing his specialist work.
Right.
But I would say is that policy-wise, we have to have a second look at our major hospitals.
Right.
And then make sure that we do things and do it properly and allow them to also do a lot of innovative approaches to improve the services.
Indeed. And Dr. Anthony Siasari, this is just the start of it. We'll definitely have that time to have another conversation on this, as you're indicating, to provide some more insight on our health facilities and also the entire Ghana health system, right? Grateful for your time, Dr. Anthony Siasari, for your time. He's the former presidential advisor on health. Bright Mr. Nyako is the national chairperson for the NGOs in health, and also to you, Dr. Thomas Anaba, who is a former REACH CEO and now MP for Garo and a member of the Health Committee. It's been UPfront. My name is Blessed Sogan. Until then, log on to myjoyonline.com. More stories there for you. Thanks for your time. Bye-bye.